What kinds of things could you envision compromising on? What principles could you see compromising on to get at least a piece of what you're looking for?
Yeah, I'm not, the favorite friend of the insurance companies. I don't necessarily know what value they really add in the system, but I'm not going to be for a system that just gets rid of the insurance companies. I don't think that's, conceivable or possible in the near future. I'm certainly going to push them, to make sure that they do add some value. I certainly think we have some issues with the pharmaceutical companies, about advertising, about marketing, but I think they are, a truly American industry that actually, has some of the answers to the healthcare crisis. So I think we're going to sit down and try to let everyone be part of the system if they're going to add value and if they're going to make compromises. And I think when people stand in the way of change, maybe they should pay a price.
Every 4 years, we seem to have conversations like this. Is 2008 any different?
I actually think we haven't had this conversation since 1993. I think, we've had a lot of conversation about policy since 1993, but this is now about politics and leadership. All the answers surround us on the healthcare situation. I think 2008 is different. I think costs are out of control. The business community is asking for change. The providers are asking for change. The consumers are asking for change. And we have at least one presidential candidate who's saying that he thinks in his first term that he will be able to have a healthcare system that we've been after for a long time. We cannot let this get out of our way. This is not the third rail of American politics or democratic politics anymore. This is what America needs to have a new economic plan for our country. This is what America needs to be a great country again. And I think we're going to see that discussion in 2008 with real proposals and real opportunities for change.
What do you think needs to happen more specifically? For example, at this moment, we don't know who the nominee is in the Democratic Party, whether it's a Clinton White House, an Obama White House, a McCain White House. If something is to be done, does it need to be done early and quickly?
I think the lesson that we've learned in almost California recently, Bill Clinton's first term, is when you have momentum, get it done. You can't negotiate forever. You need to involve everybody on the front end, not while the bill is moving through Congress. I think a new president, either one of the three, need to begin to think about what is their plan, how they're going to get it passed, how in this town do they build some of the same coalitions you're seeing being built with the NFIB and Divided We Fail, that we're in as well. So I think you need to set the stage for healthcare if you really get it done. You can't wake up on January 21st and say, I wonder what we're going to do about healthcare. You have to wake up on January 21st, the day after you announce in your State of the Union address that this is going to be your top American domestic priority, and then you got to do it.
And if you had a magic wand and you could say that 2 years from now, some things would be different, what would you anticipate those things to be?
Yeah, I don't think there's any way to do this incrementally. I think people are ready for fundamental change. And what we've learned in Washington since 1993, we can't even pass technology, legislation. We can't pass certain legislation about chronic disease where there's a lot of unity. So it's no easier passing one small thing, in my humble opinion, than one big thing. And I think a new president gets a lot of opportunity to get one big thing done, whether it was George Bush and taxes or No Child Left Behind. I think Barack Obama domestically should say, my one big thing is health care, and it's time for Democrats and Republicans to come together with the business community, consumers, labor, the insurance industry, and get this thing done once and for all. America deserves it.
Well, it's interesting that you say that because of everyone we've interviewed in this series, some people say exactly the opposite of what you've just said, that we need to do it incrementally, that smaller steps are the answer. You say big and bold. And I'm wondering if other important players who will be at the table feel as you do, or do you think incremental will take over?
I think incremental has failed. It will continue to fail because all you do is draw out very specific interest groups with very different points of view on one little small thing. You see a lot of times when governors, get elected and they make their first budget, they turn everything upside down because they know they have 3 more years before they have to come back and deal with all the changes again. I think this president has to turn this healthcare system upside down in the sense that he needs to say, it's not going to be incremental. I'm ready to solve this problem, and it's not going to be perfect. And I've listened to all the ideas. And if you want to get on our team, let's go play. And I think a lot of people are ready to play for fundamental change. I think people understand we don't have 20 more years to control costs. We don't have 5 more years to deal with chronic disease. Even passing some of these things will take years, to implement a new interoperable computer system. So I think we got to start now. We got to start big. That's what elections are about, to give people big change. I think Americans want it, and I think if they stick, and we intend after the election to spend as much money. We're going to spend nearly $100 million, make 10 million phone calls, have hundreds of our organizers not go to sleep after Election Day, but to stay in communities and on the phones talking to voters about their senator and their congressman living up to the promise to change our healthcare system. Our campaign is going to be just as big after the election as it is before the election.
$100 million after the election.
After the election.
To
and
push
staff,
the healthcare agenda.
Yes, and we're actually going to put $10 million of the $100 million aside in a fund for any of the candidates who run for office saying they want fundamental change, and then back up and say, well, I'm sorry, I really only meant incremental change. They are going to paint a target on themselves for a little bit of an accountability question for the voters in their district.
Okay, we'll check back with you next year.
Thank you.
Andy Stern, thank you so much.
Appreciate
it.
The Kaiser Family Foundation presents health08.org, election news, analysis, and events.